In the meantime, the United States Embassy in Kenya has maintained that a proposed Ebola bio-isolation facility Laikipia poses no risk to nearby communities, even as legal and public scrutiny over the project continues. This comes after a court suspended aspects of the project following a petition challenging its implementation. The embassy says it is working closely with the Kenyan government to address concerns and clarify the objectives of the facility. Suzanne Locho has more details.
The United States Embassy in Kenya says it's aware of court action filed in the country and it's working with the Kenyan government to address objections while communicating shared public health objectives following a court suspension of the proposed Ebola bioisolation facility in Laikipia. It maintains that the Laikipia bio-isolation facility is part of a broader effort to prevent the spread of the disease and reduce regional health risks, and says it does not pose a risk to nearby communities. The embassy says that the United States remains the largest financial contributor to the Ebola response effort, with direct assistance from the Department of State exceeding $350 million through OCHA pooled funds supporting the DRC, Uganda and South Sudan. The debate continues. However, while asked what would happen if Kenya was to block a planned U.S. quarantine facility for Americans potentially exposed to Ebola, Dr. Mehmet Ozi said that the State Department is confident it can work out an arrangement with Kenya. This comes as discussions continue in court and in public over a suspended project amid heightened scrutiny of regional Ebola preparedness.
We are confident, and the State Department is working on this diligently, that they're going to be able to work out something with Kenya. There has already been a fair amount of communication around this issue. We have and that's by the way, there's a UK base there. We have other people who might be willing to welcome us, and we have our German colleagues as well. So there's many places we can send folks, but sending them across the world, especially when we're not sure what's going on with them, is probably not the wisest.
On prevention measures, as Ebola concerns rise along the Kenya-Uganda border in Busia County, KEMRI has donated protective equipment to boost preparedness and support frontline response. At Busia County Referral Hospital, KEMRI and county health officials reaffirmed joint efforts to strengthen surveillance, with leaders assuring the system is ready to handle any Ebola cases.
We are here to receive a consignment of hand washing, and sanitizer, personal protection equipment, and some thermoguns, and also some disinfectant, which helps us to get rid of whatever impurities and viruses there may be around us.
Meanwhile, the ongoing Bundibugyo Ebola outbreak in the Democratic Republic of Congo and Uganda has highlighted weaknesses in Africa's health system, prompting an emergency meeting for senior health officials to discuss a coordinated response.
And we've tried to consolidate all of these priority actions, and on top of the list, all the member states have asked strengthening of the borders. Another issue is the propositioning.
The crucible of COVID-19, previous Ebola outbreaks, Mpox and cholera has forged a singular truth. No nation can build a fortress of health security alone.
Suzanne Locho for TV 47.